Hi, this is ggoernert of ggoernert Wealth Management, and this is my Insights and Perspectives podcast. Welcome to Insights and Perspectives, If I Knew Then, the show where we share the stories of the successes and challenges entrepreneurs, business owners, and world changers face on a daily basis as they build extraordinary lives. We celebrate their triumphs, both personally and professionally, learn from their setbacks, and reflect about what they've learned about themselves. In this episode, I'm joined by Colin Hansen, former Health Minister, Finance Minister, and Deputy Premier of the province of British Columbia. Now, you were Finance Minister during the financial crisis in 2008. What was that like?
It was probably the worst possible time to become Finance Minister in any jurisdiction because it was particularly challenging. He started out the conversation by saying, "So, Minister, I never thought I would see a day when we were losing $200 million of projected revenue a day."
Welcome to the December edition of my Insights and Perspectives podcast. I'm so happy to be joined this month by Colin Hansen, former Health Minister and Minister of Finance for the province of British Columbia. Now, if you haven't checked out this month's newsletter entitled Lowered Expectations, please click the link below or find it on my website at www.ggoernert.com. That's www.greggoernert.com. Volatility is coming back to the equity markets this week as we continue to watch the newest reality TV show, Celebrity Apprentice, The Trade Wars, featuring Donald Trump and Chinese President Xi. Every time the market seems to be confident that a phased trade deal is upon us, something comes up to dash those hopes. At some point, a deal will get done. But with a U.S. administration that prides itself on being unpredictable in order to get a good deal, I wouldn't predict when that's going to happen. My guest today is the former Minister of Health and Deputy Premier of the province of British Columbia. He's also served as Finance Minister, Minister for Small Business, Minister for Economic Development, responsible for the Asia-Pacific initiatives and Olympics leading up to the Vancouver's 2010 Olympic Games. He and his wife Laura are co-founders of the Image Group, and he has served as Vice President of Finance for the Asia-Pacific Foundation. Welcome, Colin Hansen.
Thank you.
So, just thinking as we're coming in here, that every topic that's top of mind right now, you've got an intimate knowledge of it. Why don't we start off with health? You were the health minister. Just tell me some of the changes you've seen over the past 10, 20 years in healthcare and how it's grown and maybe how things are changing demographics and just from a bird's eye view of what you've seen.
Well, I think that in health, what we've seen is technology making progress. More things can be cured, more cancers can be tackled through technology, but it comes at a great expense. And I have this adage that I think is so true about healthcare, and that's that making change in healthcare is easy, providing it's incremental. But if you want to fund something that's new and innovative in healthcare that's going to make a real difference in people's lives, and the way that you're going to fund that is by ceasing to fund things that are no longer priorities in terms of a healthcare budget, that's when it gets difficult, because there are so many stakeholder groups within healthcare, each that are protecting their own turf, that it makes it very difficult for governments to be able to sometimes allocate funds where they are most needed. There's an expression which I think is attributed to John Ralston Saul, Canadian author, from about 30 years ago. And he said, healthcare in Canada is suffering from stakeholder through the heart.
Interesting. So I guess just making priorities, I mean that's the difficult thing, because you're dealing with people's health, and I get that as well. But if everything's a priority, then nothing's a priority, I guess. And how is that balanced off, and what kind of discourse around that? Because my sense is that we never seem to be able to have an apolitical discussion about priorities and what what's the measurable outcome that we're looking for on healthcare, in particular, because it's such a hot button issue for so many people.
It is, and I think that one of the things that I think everybody involved in health policy will agree to, and that's that we need to shift our priorities from treating illnesses to prevention. Now, that's a no-brainer. Everybody can sort of say, absolutely. And then you sort of say, well, why isn't it happening? Well, it is happening in a gradual way, but it's like turning that supertanker. It takes a lot of time to make those kind of changes. The biggest challenge between sort of putting more resources today into prevention is that you still have to deal with the illnesses that could have been prevented but weren't. So it's like it's the upstream downstream argument. They say that we've got to go upstream in the healthcare system, prevent people from falling in the river in the first place. Well, that's great, except meanwhile you got a whole bunch of people going over the falls, and you can't stop hauling people out of the river who are going to drown in order to go upstream to do the prevention work. So it is change that takes time. I think there's a lot of things that we could be doing sooner in terms of healthcare to get those cost drivers under control, and that's the use of information and data. We are, most industries in our economy have been absolutely disrupted by the use of data. And when it comes to healthcare, which is such a huge part of our society and our costs of our economy, we do very little when it comes to mining and using the data that's available to us in the way that other industry sectors have.
I'm just off the top of my head, I would think insurance. They would have a ton of data on, actuarial tables on outcomes and things like that. You would assume that there'd be. You guys have a treasure trove of health.
Absolutely, and what's interesting is British Columbia is unique in the world in terms of the longitudinal data that we have here in BC. Because what happened in British Columbia in, I guess it was in the mid-1960s, was when the government of the day started forcing doctors to submit their billing electronically.
In the 60s?
Mid-1960s.
Wow,
so
I didn't realize that.
We have data when it comes to physician billings that go back that far. It's pretty raw data, and some would argue that it's difficult to use because of just what was available at that time. But one of the most significant things that happened was actually under the NDP government, which I'll give them total credit for, is bringing in the PharmaNet system in the mid-1990s. And this meant that every single prescription filled in British Columbia by a pharmacist had to be logged into the PharmaNet database, regardless as to who paid for it. It could be paid for by an employer benefit plan. It could be paid for by government through PharmaCare, but every prescription was logged. So that data has got, it could be used to solve so many issues. Think about adverse drug reactions, where you wind up with a person that takes pill number A and pill number B, pill A, pill B, and suddenly they wind up with some kind of other serious problem that's triggered by the interaction between those two medications. The medical science isn't really set up very well to identify those things, but we've got the data to actually go back and identify where those problems are originating, or quite frankly, how we could be saving billions of dollars out of healthcare costs, and we're simply not using the data in a way that we should. And it comes down to people's paranoia about privacy. Well, that can be addressed. And I've had conversations with the privacy commissioner of the day about using data, and Elizabeth Denholm was the privacy commissioner at that time, and she was totally supportive of more use of data. But
because it would be metadata, it wouldn't be individual data.
So the thing is I think people need the reassurance, which is there, that their information about their personal circumstance is going to be anonymized. But we've got the technology to do that. We've got the systems to do that, it needs to be aggregated. It needs to be anonymized in a way that sort of somebody can't trace it back and sort of say, well, this was Greg's data from when he went to see his doctor. And that's all doable.
Interesting. So, when you first became health minister, let's just talk about growth of the budget for health, and maybe walk me through a little bit where it was and where it was when you left. And we've got this big demographic bubble that's already into the 65 to 70 range. You know, once you get closer to end of life, that's when you start using all the health care. When we're younger, we use much less of it. And what kind of pressures that's going to be put in the system, and what strategies are being used to just try to manage that?
Yeah,
reality.
It's huge, and it's I became health minister in 2001, and the year prior, in the last year of that NDP government, the provincial government's expenditure on health was about 10. Well, I guess it was 9 point something billion dollars. Well, the latest budget that came down last February, the budget for health spending in BC is $23 billion. So, you know, one of the things when, the years that we were in government, the NDP often sort of railed on about healthcare cuts. Healthcare was never cut. It went up every year. It was the big elephant in the room when it came to trying to balance budgets. But the cost pressures in healthcare are huge. As I say, I don't think we're doing enough to try to manage those costs down. And it's also, you can't equate how much money is spent to being a good healthcare system.
Well, that's a good point
and
too,
it's
because
about outcomes that are important, not just simply how much money.
If we throw more money at it without measuring what the use and what the efficacy of it is, like what's really there. Well, other drivers, are there any administrative drivers, or is there looking at it right now is it a little bit like the 50s where Eisenhower warned about the military-industrial complex, that there might be a health-industrial complex out there that's kind of reinforcing itself into its growth?
Well, there is. I think particularly in Canada, we would be able to, I think, develop a more cost-effective healthcare system if there was more competition. Right now it's mostly a government monopoly in terms of how healthcare is delivered. And yet we're seeing in other places around the world a lot of innovation coming into healthcare, which does drive cost savings.
Well, yeah. I mean, when I talk to people from France, or I've talked to people from Great Britain, Germany, their models are competitive.
And they don't have all the answers either.
No, I'm not saying that.
Every country in the, I was going to say in the developed world, it's probably every country in the world is facing the same challenges when it comes to rising healthcare costs.
Yeah, but it would be nice to be, to actually even have some conversations about different strategies and find out, best practices, what's working, what isn't working. Because I know we always seem to have a tendency to look down south and go, we don't want that, and I get that, but that's just one model out of many. So, okay. So we've got the growth of healthcare, we've got cost drivers, we've got demographics. You brought up information technology, data, and you kind of talked a little bit about prevention as well. What do those programs look like when you're trying to be preventative? And I know that you have to deal with what you've got now with the population, but you're kind of looking 20 years from now, and what kind of preventative measures do you envision or are being proposed?
I think that health prevention, when a lot of people, they think about it as I've got to exercise more, I've got to eat a healthy diet. Those are important parts of prevention. But I think that also how we manage health conditions is also an important part of prevention. For example, if somebody has developed, type 2 diabetes, you can't sort of put them in a time machine and go back and sort of say, well, get more exercise 10 years ago. So, but you still can take a preventative approach to chronic illnesses by saying that, let's manage that diabetes in a way that keeps the person out of hospital. But you have to manage proactively. So I think there's a lot more that we need to do. And I think to give the medical community credit, we've made great progress on that front over the last 20 years. So it is about, not waiting for the crises to hit and then try to fix the problem. It's about, how to not just to prevent the problem, but how to prevent the problem from getting worse.
Right. So how does that look? Is that outpatients or is that community or home care? I'm just trying to get an idea of how that would look before they're getting into the critical care.
So one of the things that we developed about 18 years ago, it sort of started in BC when I was health minister. I don't take credit for it because we had some great public servants who were driving this agenda, but that's around chronic disease management. So in those major chronic disease groups, whether it's heart conditions or whether it's diabetes or, to proactively manage that patient's conditions.
Mm-hmm.
So the incentives were put in place for doctors to take more time to drive a prevention agenda with a patient. And that, BC's innovation around chronic disease management has now been replicated in jurisdictions, well, certainly throughout North America. I think probably goes broader than that.
Mm-hmm. Interesting. Now, can we just touch upon a little bit on the BC Cancer Agency and developments of over there over the past, I guess, 20 years since you've been there? What's changed from that standpoint?
Well, I think that's an area where BC has been a leader in the world. I can remember when I was health minister, I had a dear friend who sort of pulled me aside at a function and sort of told me that his dad had been diagnosed with a particular type of cancer. And he said, so, where should we go? He was willing to go anywhere in North America to get his dad the best care possible. And I said, you're right here in British Columbia. British Columbia has the best outcomes when it comes to transfer cancer treatment of any place in North America. And so in the past couple of decades, well, first of all, one of the reasons why BC has excelled in cancer treatment is because of data. So the BC Cancer Agency, going back several decades now, I think it's probably the early 1990s or maybe even older, started a very methodical approach to collecting data and integrating both treatment and research. So it wasn't just doing sort of some rarefied trial at in a university lab. These were actually patients that were being treated for their conditions, but they were the research was being incorporated into that mainstream of care delivery. So BC is today a recognized leader in cancer care around the world, and there is new research, new developments coming along every day that are helping us make progress on cancer care. BC has a lot to be proud of. Interesting.
So we talked a little bit about BC Cancer Agency. Now, where do you see healthcare over the next 20 years going? It seems to me what you're saying is that you've got incremental change. You think there's a big opportunity for data and prevention management, if that's kind of the phrase. So looking at 20 years, how do you see the system looking?
I would love to say that there's going to be some significant, profound change, but I think first of all, when it comes to healthcare, it's very difficult to have profound change. It has to be, I think, gradual, like that supertanker we were talking about earlier. But I think that individuals will take more responsibility for their own care if they're given the opportunity, mm-hmm. and that's a big if. And just to give you one example, let me back up just a little bit. When it comes to all of this information, health information, is sort of this fundamental question: whose information is it? Does my health information belong to me, or does it belong to government? Mm-hmm. And I think increasingly, as you give individuals access to their own healthcare information, they will be able to make better decisions in terms of how to optimize their health outcomes. So in BC, just to give you one example, if you go in to get a blood test done, and I've had a couple of them over the last few years, and I'll go into Life Labs and
right, yeah.
I'll get the blood test done. Say it's 10 o'clock in the morning.
Yep.
I can go home, go online by about 6 o'clock that night, mm-hmm. into my own health account,
right.
and I can get access to the results. And the first time I did that, there were a few terms that I had to look up and find out what an RDW score was or whatever.
Right.
But once I did that little bit of research, I knew how to read the results in a superficial way. So it would be, a week later, I'd get a phone call from my doctor's office, and they would say, hello, doctor, your doctor asked me to give you a call and just let you know that your blood tests are in and everything's okay. I knew that.
Right.
I knew that a week ago. That system was set up by the private sector. It wasn't government that put in place that data system that allowed me, using my passcodes, to be able to go in and access. That was a private company. And I think that the more you give patients access to information, the more you put them in control of their own health outcomes, as opposed to them just being somehow, relying on the system.
Exactly,
to
being
take
almost,
care of the health
almost
for
a
them.
victim in that, like by being passive and just kind of being pushed through a machine versus being
Yes.
to be an active participant with
So
it.
I think technology is a very enabling thing. In the idea that you can take medicine, medicine can be available through a telephone,
Yeah.
and diagnoses, and it's not all about getting in a vehicle and driving to a doctor's office. There's
No.
other ways that people can take care of their own health.
I agree, and with the more people know, usually the better it is. However, I do have a doctor friend of mine who has a mug, and on the mug it says, "Your internet search doesn't equal my 6 years of medical school."
Mm-hmm.
So, now, when we talk about that, we still kind of do block funding, and we've got a single payer. I think there's definitely a place for competition in the system. The government can pay for it, that makes sense, but that kind of innovation came from the private sector. That's not going to come from the government sector, because in the private sector there is a push to do things as cheaply as possible to get as much profit as you can, because that's the whole model. And if you can do it cheaper, you can compete. Do you see any room for that kind of competition in BC? I know we've got Dr. Brian Day with the Cambie Street Clinic, and there's a big court fight over that now. We've seen what's happened in Quebec, I guess 10 years ago now. But we still, in my mind, we can't get past this idea that somehow competition is bad.
Yeah, and that's why I think Canada is it's not a case of falling behind. Canada is an innovator in so many fields, in so many ways. In healthcare, we do have our success stories, including cancer care, which we talked about. Mm-hmm. But I think Canada could be doing so much more when it comes to healthcare innovation if we were to foster more of a spirit of competition and the drive to find efficiencies. And it's not just about, I think the other thing that we do is, Canada, if memory serves me right, is second in the world when it comes to the amount that governments fund for research and development. Mm-hmm. Like, I know we're laggards when it comes to private sector funding for research and development, but in Canada, when it comes to government-funded research, we're one of the leading nations. But when it comes to health research in Canada, so much of it is aimed at sort of trying to develop the next frontier. It's kind of like, the scientist wants to have the big new breakthrough innovation. Right. When I think a lot more research should be focused on how do we actually have an efficient and effective and affordable healthcare system. Just to give you just one example that comes to mind, it was an American that developed I'm going to get my metaphors wrong here now. It was Connaught Labs in Canada. Okay. It was an American that developed the vaccine, but it was the polio vaccine.
Right.
Jonas Salk,
yeah.
I think it was. But it was Canadians who figured out how to produce millions and millions of vaccines cost effectively so that they could be used around the world to eradicate polio. And we just, there was Connaught Labs in Montreal that did that. And I think that we need to celebrate those kinds of successes more in Canada more in healthcare generally around the world. Let's celebrate the breakthroughs in efficiency as much as we celebrate the new breakthroughs in terms of the brand new frontier in medical science.
And that brings up a good point, or something just kind of tweaked in my mind. Is it your impression that sometimes as Canadians, or maybe actually in the Western world, but that we've become a little too complacent to the diseases that we've eradicated, or now it looks like we've almost eradicated, and kind of take it for granted that, it wasn't that long ago we had polio, it wasn't that long ago we had measles. We have all of these things that, in some cases were protected by that, the herd effect, but we've kind of forgotten. It wasn't that long ago, go back 2 generations, there was some pretty nasty stuff out there that that we just had to live with.
And that comes back to prevention as well. Vaccines are such a huge part of prevention.
Oh, absolutely.
Globally around the world. And it's when I hear people that have these anti-vax campaigns, my blood boils.
Well, it's just so anti-science.
I think for a parent not to get their children vaccinated, the parent should be charged with child
abuse. Absolutely.
I think it's absolutely irresponsible for parents to deny vaccines to their children.
Oh, and the pseudoscience that's used to back it up just drives me crazy. My background is statistics, so you get a study. What was the Wakefield study? Was 6? The cohort was 6 kids. The Lancet's still trying to live that down. Can we talk just a little bit about mental health? Because I look at, we have what's called a homeless issue, but I look at that and I think a lot of that's a symptom of substance abuse and mental health issues that aren't being dealt with. And there tends to be a group that almost enables that system of these people like living as zombies on the streets. And what are the changes you've seen there? Because my impression, just anecdotally, it looks like it's gotten a lot worse, the homeless issue. And I know that's not necessarily a healthcare issue, but in my mind, if you're coming from the mental health issue and the substance abuse issue, that's got to be part of it. What have you seen?
I don't think you'll find anybody involved in healthcare that would not say that we need to put even more priority on mental health and addiction issues. But it's also not just about spending more money on it.
Right.
This is a study that I think goes back probably about 12 years now. It was done by some researchers at the University of Alberta, and they looked at all provinces in Canada, and the question was, and one of the things they looked at was the percentage of the health budget that was spent on mental health and addictions. And if my memory serves me right, the Canadian average was 6.7% of the health budget being spent on mental health and addictions. In British Columbia, we were spending 9.2% of the health budget on mental health and addictions, the highest by far of any province in Canada. So the question is, is there a greater incidence of mental health issues in BC? I would argue there's no evidence to that I've seen. So I think what it really comes down to is, are we spending the available resources as effectively as we should? At the time, one of the things that I pushed for was to do a study of the cost effectiveness of our mental health and addictions program. Are we getting value for money?
Well, and that's interesting, because that was the thought that came across in my mind, is because first we always seem with any health issue, or the first reaction is to let's throw a bunch of money at it. But how much analysis of the efficacy of the money spent is actually done study-wise, that's reviewed, that could be agreed upon at some points? Because I know politics rears its ugly head when we get into, then you have one sector go, well, you're just looking to cut. It's like, no, we're not looking to cut. It's just like, what are we actually doing here? Is it working? Is it not working?
Well, in the Ministry of Health, we have in BC, we've got a phenomenal public service. That's not just true of the Health Ministry. It's true, I think, of the provincial government generally. From my 17 years in elected office and 10 years in cabinet, I stand in awe of the talent that we have. And within the Health Ministry, the policy branch does great work in looking at the cost drivers, how to do things more efficiently. But a lot of it is entrenched in sort of status quo. It's health is very resistant to change, and even in the face of evidence that things could be done more effectively, sometimes it's hard to get the stakeholders on side to make the changes necessary.
Right. Can we just jump off to a couple of other things too? Because you were minister leading up to the Olympics, responsible for the Olympic file, I think from 2006 to 2008. Tell me a little bit about that, because for British Columbia, for Vancouver, that was such a seminal moment for the city, and really, I think, reinvigorated the city if it wasn't known already around the world. That really helped. So maybe share some of your experiences on leading up to that.
It's So part of my title was minister responsible for the Olympics, and that sounds bigger than it really is. It was a big file, not to diminish it, but the responsibility for delivering the games was Van Hock, under John Furlong's leadership, and he did just such an amazing job in pulling all that together. And the federal government had responsibility for security issues in that, which was big, and that was actually some of our biggest frustrations. It's really the Olympic movement is it's a city that has to be awarded the game. So it was Vancouver was sort of the lead jurisdiction, but it was the province that was really trying to drive the necessary infrastructure. So people talk about how expensive the Olympics were. It was actually pretty cost efficient for what we got in return in terms of profile and tourism and our reputation internationally and globally as a place to do business, for example.
Just ask the Russians if you want for.
It was
spent what, $60 billion?
Yes, the Canada line was built a little faster than it might otherwise have been built. The Sea to Sky Highway was rebuilt sooner than it would have otherwise been done. But those are the kind of projects we needed anyways. We got new sports facilities out of it. So it has a truly lasting legacy on the province. But at the same time, it was frustrating because there were so many moving parts. And you look at the financial challenges around the building of the Olympic Village for the athletes' accommodation. I can remember over Christmas and New Year's trying to get a week out of town just to relax in Hawaii, and I spent most of that week on long distance conference calls trying to sort out Olympic problems at the time.
Well, because in 2008 there was the financial crisis,
yes.
And the Olympic Village was, if memory serves, the builders, that was part of there was a definite funding issue.
Yeah.
Yeah. To put it delicately.
Yeah. No. I moved into healthcare or into finance. I served for 6 months in finance between Gary Collins and Carol Taylor's time in finance, and then after Carol, I was back in finance for 3 years. I remember I went back into the portfolio in June of 2008, and of course the Lehman Brothers meltdown happened in September. I remember that weekend vividly.
I do too.
And it was certainly probably the worst possible time to become finance minister in any jurisdiction, because it was particularly challenging.
So what was that period like for you, just generally as finance minister? Because that had world implications, and just moving past the Olympics. But and if you were around in September, October 2008, when Lehman went down, when it was looking very, very, very scary at that point.
I think it's like any crisis. You never know. You don't know where the bottom is until you're well past it. And in hindsight, you can look back at a crisis like that and sort of say, oh yeah, well it was pretty bad when it was at its worst. What's even worse is the week before it got really bad, you don't know where the bottom is. You don't know how much worse it's actually going to get.
Yeah.
And I remember one conversation I had. It was a Friday morning in Victoria, and the assistant deputy minister who was in charge of putting the budget together for the following February. This would have been early December, and no, sorry, this was early January. And he came into my office with his weekly update on progress towards getting the budget ready. And he said to me, and he had been in the public service for a couple of decades, like going back to the social credit days.
Right.
And he said, he started out the conversation by saying, "So, Minister," he said, "I recall one time when we were trying to get the budget together and we were losing over $100 million of projected revenue in a week." He said, "I never thought I would see a day when we were losing $200 million of projected revenue a day."
Wow.
And it was, and he said, that's what that week had been. Is like they've got their computer programs where they can generate what to anticipate in terms of revenue, and then of course that gets built into the budget because we had to make sure we had to prove the revenue projections before we could develop an expenditure program.
Yeah.
And it was just like shifting sand. It was constantly getting worse every day on us.
Wow.
And it's even, we came through that. We had to go back into a deficit budget, which was one of the toughest decisions I had ever been involved in government, because we had worked so hard to get rid of the deficit budgets. And that year we had no choice. And even then, when we locked in the budget, we thought we were building in a whole bunch of prudence.
A lot of contingencies.
We were pretty conservative contingencies. We weren't even close. It just got so much worse. It erased all of our contingencies in just a matter of weeks.
Oh, it was so fast too. And it was that. I mean, that was the literally didn't know what would happen next.
Yeah.
Now.
But actually, just let me finish.
Yeah, go ahead.
So in that budget, one of the things we did, for example, is we looked at every aspect of discretionary spending in the province, and we tried to trim everything we could. Just to give you one example of an innovation that came out of a crisis.
Okay.
It was we slashed the travel budget that was available for public servants to travel around British Columbia. We slashed that by 27%. Discretionary spending.
Right.
What we actually realized was over 50% reduction in travel costs in BC, because what we did at the same time as cutting budgets, we put money into the capital budget to put in place teleconferencing facilities around BC. What we discovered was that the public servants around the province, they didn't want to get on airplanes and fly to Victoria for meetings. They were quite happy to use the video conferencing and teleconferencing equipment that was available.
Well, it's a waste of your day. You got to get in the plane.
So what started out by a crisis, by us trying to trim a budget by 27%, wound up with a whole transformation in how government works.
Interesting. Well, now, I want to talk just a little bit about, just if we could, about the HST. Because that ended up being your file, and just walk me through some of the logic and some of the rationale for it. As I mentioned, my background is in economics, so I'm well aware of the rationale for HST and replacing the manufacturer's sales tax and all the other things that harmonization is good for. Which, in my opinion, some of the reasons why people hate the HST so much is because it is transparent and it's all the things a tax should be. So,
yeah, it's. I guess there's no question that it is a far more effective and efficient tax than the provincial sales tax that we have in place in British Columbia, and the provincial sales tax that we have is a big drag on our economy. If you look at the marginal effective tax rates on investment, BC is a laggard in Canada now, and it's all because of the provincial sales tax, whereas other jurisdictions in Canada have a value-added tax in place, with the exception of, I guess, the one place, in addition to BC, I think Saskatchewan still has their traditional sales tax. So it was in the middle of the 2009 economic crisis that the HST became an opportunity for BC. We were looking at ways as to how to cover our budget deficit. It was what the federal government put on the table was $1.4 billion for British Columbia as transition funding. That would have helped us a lot in terms of covering the cost of healthcare and education and all of the other things that we build into the budget. But the timeline that we had was really quite constrained. So, even when the HST went to referendum, I think that referendum would have succeeded in keeping the HST if it were not for two things. The public believed that we made a promise in the election in 2009 not to bring in the HST. That's absolutely not true. The other thing that the public perception was out there was that, well, first of all, that we had promised not to do it, and secondly, that there was a perception that we had this plan before the election. That's absolutely not true either. It was a window of opportunity that came along after the election. So it was once you get that public perception entrenched, it's hard to break that down. And that was one of my frustrations, is that, and I take full responsibility for it because I was the Minister of Finance at the time. We did not do an adequate job of explaining it to British Columbia, explaining the rationale, explaining how it would work. And as a result, it was reversed because of the referendum.
It's interesting, the politicization that comes in. Obviously, your governments by their nature are political, but I find myself frustrated in many policy areas where it seems like the policies never. There's a lot of misinformation about policies. Whatever, we can disagree or agree about things, and somebody's going to come up with a policy I'll disagree with. But sometimes the discourse seems to be, based upon false assumptions, and that's got to be frustrating for you, or I guess for any member in public life.
And particularly, in the social media age, you can take false information and it can become entrenched and spread so fast that I think it makes governing all that much more challenging.
Interesting. Now, you have a role, or you had a role on the Asia Pacific Foundation. Why don't you talk just a little bit about what the Asia Pacific Foundation does, and then I'd like to talk to you about China, since that's obviously something you've had some firsthand knowledge of.
So you're taking me back to 1983 now.
Okay.
That's
probably a good time. That's probably a good time to start with that, because it's things have evolved since then.
Absolutely. So in 1983, there was a group of prominent businessmen and women, academics, community leaders, governments from across Canada that recognized the importance that the Asia-Pacific region would be to Canada's future, and that was the genesis of the Asia-Pacific Foundation. So I was brought in by this group of prominent volunteers to help manage the process. There's a bunch of people who can claim to be the fathers or the mothers of the foundation. I claim the role of midwife. I helped deliver the baby, and actually became the very first employee of the foundation in 1984 when it was officially incorporated. So, that's an organization that has done tremendous work over these decades of fostering better understanding between Canada and the countries of the Asia Pacific, and really trying to look at how Canada can prosper from that relationship in the long term. So their vision is not about sort of what's happening 6 months from now or a year from now. Their vision is looking at, where do we have to be 20 years from now to make sure that that those relationships are strong as they can possibly be.
Mm-hmm. Now, over that period, obviously China has changed so much, and that is a huge trading partner, but it's got some challenges of its own, and we're seeing how things have developed there as well. Any thoughts from your experience on how the trade flows have changed over this period?
Yeah. So in terms of the economic interdependence between Canada and China, that has grown dramatically, over that period of time, and I think generally speaking, that's been incredibly positive for both countries. I think the things that have happened recently. First of all, I think the government in China was making real progress towards their becoming part of the international global community, and I think they're squandering a lot of that goodwill right now because of some of the decisions that government has made. You know, like the imprisonment of the two Canadians, I believe is unconscionable, and I had a lot of respect for China in terms of how they were eradicating poverty, how they were building a modern society, you know, pulling 700 million people out of poverty and into middle-class economic standards. You know, that's a tremendous feat that China is rightfully proud of. But I think that the way they are flexing their muscle right now is undoing a lot of the goodwill that they had built for themselves over the year. The issues around human rights, you know, again, from Canada's perspective, it's not something that we can condone in any way. We need to continue to find ways that we can encourage China to address issues of human rights, but you're not going to do that by simply cutting off contact. You got to do that by constructive engagement with China, and you know, we got a better chance of working with China as they modernize. But unfortunately, I think the 2019 will certainly not go down in history as a constructive year for China when it comes to their modernization and their internationalization.
Now, here's a question I ask everyone. Colin Hansen, if you can go back 20 years ago, 25 years ago, when you were starting out in public life, what's the one piece of advice you wish you could give yourself?
Oh, that's a good question. Take more time to build networks.
Interesting. And what does that mean to you?
Well, it's, you know, I had as a Minister of Finance or Minister of Health, I had the opportunity to pick up the phone and get the advice of just about anybody. You know, it was, you know, bright, knowledgeable people wanted to share advice and information, and I probably didn't do. I wish I'd done more of that. And it's not that you've got time. It's you know, as a minister in the provincial government, you're going 24/7. But I probably should have found more time to just make those, to build that network and get. I did it a lot, but I mean, I wish I could have done even more of it.
Exactly. Well, I just wanted to say thank you so much for joining us. This is a fascinating interview, and I really appreciate you taking time. Thank you, Colin Hansen.
Great. Thank you very much.
Hey, thanks for listening. Don't forget to subscribe and visit us on our website at ggoernert.com. That's ggoernert.com. Thanks again.